Okay, I think we're going to get started then. Wow. We have a standing room only crowd, let it be noted. So I'm Neil Kelman. I'm the president and CEO of the Institute for Family Health. I want to say a couple of words about the Institute, and it's just amazing to be here. And I'm so grateful to so many people in this room. I know we're not going to have a chance to mention everybody, but this room is really incredible. And you just feel cheery being here. So the Institute is a federally qualified community health center. This is something that was started by a few of us. Yvonne Eisner, who's here in the front row, and myself were two of the four original founders. We're the only two left. And so we're here taking pride in another amazing accomplishment of our staff and all of our friends. The Institute was started because we had a vision that we could develop a health facility. This was before we even knew what community health centers were. But our vision was to set up health facilities wherever there were communities and people in need. And our commitment at that time was that we would never turn a patient away. It's been a hard thing to fulfill in the current economic environment, and I would love to say that things have gotten easier in the last 40 years since we started, but actually they've gotten harder. As you know, healthcare has become more of a business than a service. Lately, we see venture capital dollars being poured in and government dollars that are rare being harder to come by, and lots of people who still, after all these years and after all the commitment of so many people, so many doctors, nurses, healthcare providers, behavioral health people that are dedicated to this work, that we still see so many people who are so much in need of health services. Shortages of people in primary care, behavioral health. Nobody can find a dentist. It's unbelievable where we are as a country right now. And the pandemic just made things worse, but the problems existed. Everybody likes to blame everything on the pandemic, but really the problems existed long before that, and they're going to exist for a long time afterwards. The workforce shortages in healthcare and everything. In spite of that, our work at the Institute is not just to deliver healthcare, but it's to help change policy. And so we use what we know and what we learn from our patients about the struggles they have, about the obstacles they face in getting healthcare. And we use that to have a voice in healthcare policy. And we try to sit on as many state, local, federal, and other committees as we can get appointed to be able to take what we learn from the needs of our patients and bring them to a level of policy where there can be change. At the same time, we have a responsibility to take what we know about the healthcare system and, in addition to teaching our patients about healthcare, try to teach them how to navigate their way through an increasingly complex healthcare system to be able to get the care that they need. So it's been a long journey for some of us. We continue on that journey, and we try to see what we can do to improve policy. Our big issues now are around Medicaid, with a state that says its budget is crushing, but Medicaid rates that haven't been increased for health centers in over 20 years. Things like that are just really a struggle. And so we will continue to work on that. And then, in spite of all those crazy things that happen, look what we get to do. We get to open up amazing new facilities to deliver the kind of care that we dreamed about doing all those years. This is our 29th or 30th location where we have been able to do this. Some homeless healthcare sites, some sites that are in schools, and many health centers like this, Brooklyn, Bronx, Manhattan, and up the Hudson Valley. And in addition, our other method, our other goal when we started was how do you open health facilities if there's no doctors and nurses? So we've been a training organization for all these years. Hundreds and hundreds of family doctors have been trained in our 3, soon to be 4 residency programs. Family nurse practitioners in our family nurse practice residency program. Medical students from all over the world who've come and trained in our centers, and many of whom have come on to stay on with us. And so to accentuate that, I want to introduce our first speaker, Dr. Marta Sanchez, who is going to be who is, what do I mean going to be? We're here. Who is the medical director of this gorgeous facility. Marta is really, her story is similar to the stories of so many people who've come through the Institute. She came as a medical student in 2009. Then she came to do her residency here from 2011 to 2014, became a staff physician, and now that we're opening a beautiful new facility, is going to serving. How do you get something that's been in the future for 5 years to be in the present? Is serving as its medical director. So Marta, it's a pleasure, and we're so glad that you accepted this position. We're really happy to have you here. Say a few words. Thank you.
So I'm going to start off by saying, like, I'm the worst public speaker because I get so nervous. My heart rate was like 114 a minute ago. So I'm Dr. Sanchez. I'm going to be the medical director for Pine Street here.
You are.
I feel humbled and great honor. I'm going to read it. I feel humbled and great honor to be part of this new addition for the Institute for Families Health new office. I feel we are bringing closer medical care to the community, providing services such as primary care, pediatrics, by Dr. Martha Smith. I'm going to mention her. OBGYN by Dr. Barnes. I don't know if he's somewhere here. He was. Podiatry, Dr. Singh, who works at KFP, will also come here weekly. And we will also have a mental health office that is beautiful across the way. We have this beautiful state-of-the-art building that is located in Midtown area. Also my community, me being a Midtown resident myself. So I'm very excited. We are providing easy access that is walking distance to many, as transportation can sometimes be an issue. I want to also inform everyone that the original KFP is still open on Route 32. I feel like that is my home. I grew up there. I'm going to cry. And this is an extension of that office. Our center is composed, our center is composed of 12 rooms of primary care. We have mental health department as well, which will have 7 rooms for clinicians, and this beautiful space that we are located in our community room. I am very excited to announce that the clinicians in this office are 75% Spanish speakers. Christine England, Dr. De Los Santos, who joined us, who was also a resident. I really worked hard to recruit her, and here she is. Also, our nursing staff is also 50% bilingual. We have our wonderful nurse manager, Elba Benitez, who had retired, and she is back, full force. We have Jess, who moved here from KFP. We have Crystal. We have Edith, who is new and amazing. I'm going to name everyone else. Not everybody speaks Spanish, but Poonam, Jene, and our office staff, Jenna, Cameron, and Jara, also who came from KFP, and I'm so excited because I love her, and I would send her all my messages, and she always was on top of it. Let's see. So I'm going off. So what we are doing here is we're hoping to increase healthcare access to everyone, and also increase access for those who have no insurance. We offer many resources, and we never turn anyone away, which is one of the amazing things that this organization offers for anybody if you have no insurance or inability to pay. Coming from an immigrant family, I know firsthand how important that is. I grew up not having medical insurance and would only go to doctors when I needed immunizations or I didn't get better with supportive care. Until my parents became residents, and then we did have insurance, and it's a difference. So this is one of the many reasons why I work here for the Institute. It brings me great satisfaction working with this community. So I am also very excited about this community center because it has so much potential to gathering and promote healthy lifestyles to improve overall health. I'm very, I saw Kristen here, so I'm going to mention her too. I really look forward if maybe we could have some cooking classes. I know we're not supposed to because of the possible, burning and having the fire department here, but we could educate our patients on how nutrition affects diabetes, hypertension, obesity. We can have mindful classes and exercise classes. We can also have the potential for mommy and me groups because we do have an excellent lactation consultant that works as part of our staff. I just want to say the possibilities are endless.
Yeah, they're endless because, people like Dr. Sanchez bring so much spirit to an organization like this. So how do we build a place like this at a time of incredible lack of resources for primary care? That's really the question. It's like, what do you do? And in so many cases, we've had dreams that we have not been able to fulfill because of lack of resources. It's really hard to come by funding these days. If you're not a venture capital kind of attractive operation and people don't see huge profits coming out the back end of it, nobody's really investing in new healthcare facilities. And we were just so fortunate. There was a pediatric group that was in a building like that years ago, and they were bought out by another group, and they were looking to get a tax break, and they said, we need to give this building away as a donation to somebody. And so we got one of those buildings, and it was here dormant because it didn't meet any of the state standards for a healthcare facility. The rooms were too small, the halls were too narrow, wasn't accessible. It was like everything you could possibly do after it was given to us. And we were like, well, what are we going to do with this? And so literally we just mothballed it. And we said someday something will come along and maybe we'll be able to actually use it. And so we were extremely fortunate to meet up with Peter Buffett from the Novo Foundation. And Peter's co-president of the foundation. The foundation was started in 2006 by Peter and Jennifer Buffett. And they've been working in Kingston, I think, since 2013. First purchased the former Gill Farm, now the Hudson Valley Farm Hub. And their work has had enormous impact on this city. I mean, you can't even imagine how many projects and how many things they've done. Most importantly, in terms of what I know about Peter, is that he's an Emmy Award-winning musician, composer, and producer. And as a musician myself, those are very good qualities for people to have. And so Novo, though, is committed to, the same folks that we've been committed to all these years, to marginalized populations, to trying to really help people who need help in lots of different parts of their life. And we were just so happy that Peter was looking around for a healthcare partner and that we were able to be that partner in this project. Novo's made lots of large one-time capital project improvements and investments in the community. And it's just really been a pleasure. I will tell you that I have worked with lots of funding partners over the years. I have never ever, and I think everybody on my staff would say this, worked with a partner that has been as easy, pleasurable, and has shared the same values that we have in every discussion that we've had about what we wanted to do here, who we were talking to, what our goals were for this community space that we built, all of the things. Like we've been in sync from the very beginning, from the very first conversations we've had about this project. So we're incredibly grateful to you, and please come and take credit for what you've done here, man.
I don't know about credit, but first of all, I want to thank you all and our distinguished speakers for helping me find my jacket and a decent pair of shoes. I haven't been out like this in a long time, so thank you for that. And really just immense gratitude to everyone, the architect, the contractors, the construction crew, obviously Neil and Suzanne and everyone at IFH. We have the easy part. Once we find someone with the integrity and the history and all of what IFH brought, we just get to say yes, which is the most exciting thing for me, frankly. Sometimes I talk about the work at Novo as practicing 21st century alchemy. We're trying to turn money into love. And I can't think of anything more fundamental than care when it comes to love. And when anybody, regardless of their supposed status, can walk through this door and get the care and attention they deserve and they need, again, it's our gift that we can even take part in this at all. It's just phenomenal. So just gratitude, immense gratitude to everyone that created this. I will remind everyone, take comfort in the fact that pride is the last on the list of the 7 deadly sins. So take pride, all of us, in this, because it's phenomenal to stand in a place that's been a long time coming. So thank you so much.
Thank you. Thank you. I wonder how many of the 7 deadly sins I've committed. I don't even know what they are. Oh, wow. So is Senator Hinchy here? Not yet. Yes? Not yet. Okay. So I want to introduce Ulster County Executive Jan Metzger. Jen, I have just met Jen for the first time, but when she walked through the room, everybody knew who she was. She became Ulster County's first woman county executive in 2022. Woo! And she's held numerous public service roles, including serving as a New York State Senator, a town council member, and on several boards and committees. So thank you for joining us, Jen. There you are. Yay. Hey. Thank you. You like this place? Do you like the place?
I love this place. So I was one of those parents that brought their little kids here to the doctor many, many, many moons ago. And I can tell you, this is a huge upgrade. I could not be happier to be here. I mean, this is a huge milestone for our communities in expanding access to affordable care. I personally believe that healthcare is a human right, and it is. You cannot enjoy the other rights you have without your health. And too many people do not have access to the affordable care they need, and it affects every aspect of their lives. I want to welcome Dr. Sanchez and this, looks like an entirely all-woman staff. I know there may be some men in there, but I don't see them, but I'm very excited to welcome you all here. Oh, okay, all right. Oh, yes, great. But, right, no disrespect, man. But the fact that your staff, that you have, that there is so much Spanish-speaking bilingual capacity here is so critically important to serving the communities that we need to be serving here in Kingston and surrounding areas. And the fact that this is comprehensive care that you're delivering. I mean, we desperately need primary care. But all of these other specialties of podiatry, obstetrics, gynecology, mental health, behavioral health services, these are all, you are filling a gap that we so desperately need here. And I just want to express my gratitude. Ulster County has been thrilled to work with the Institute in, you're in Ellenville, you are in New Paltz, in Kingston, and now in this beautiful facility. And, this is a facility, just looking around, I think, This is the kind of thing that people with a lot of money would come, that typically a facility like this would serve the people who have the income to afford those kinds of services. And the fact that this is going to be open to everyone that needs it is truly incredible. So I want to thank you all. We are grateful. We are looking forward to working with you and supporting you in Ulster County in any way we can. And congratulations. And thank you, Peter Buffett and the Novo Foundation, for helping make this incredible, beautiful facility happen. And I do see my friend and colleague in the back, Michelle Hinchy. So I was just a stand-in for you. Thank you.
Thank you. I don't know. Hello, everyone. Hello. What a wonderful, special day. You can feel the happiness in this room, right? It's so exciting. I don't want to repeat all of the incredible things that have been said, but it's really a joy for me to be here with all of you. We were together 2 years ago, right over here in the weather that was, it was a tent, it was windy, but it was also filled with so much excitement. And to be here today knowing the work that has been put in, the attention to care on this property that has been maintained, I mean, just shows that it is this building is quite literally built on the foundation of love, right? Of making sure that we're doing the right things in our community. And it's really a special privilege to me because Pine Street was as many of you know, Pine Street was my doctor growing up. And I have still to this day, I have such fond memories of going to the doctor as a kid. And that's what you want, right? That's what we want our youth to know, that it's a safe place, that our doctors are trusted individuals, that our healthcare system is something that is accessible to everyone, no matter where you live, no matter your income, no matter your means, no matter your background or what your experience with healthcare has been in the past. You deserve quality care. And not just access, but you deserve to have guaranteed quality care. And so thank you to all of the partners, to the Institute, to Novo, to everybody here, because this is such a needed entity, such a needed gap that we had, that we are now seeing filled in a way that we are so much better for. So thank you for your time, your energy, your money, your love, your time, and to the staff. Thank you for what you do in our community. We need you. We love you. Thank you for choosing to be in Kingston to serve our community. I represent a healthcare desert. And so in a moment where we are losing healthcare services at a clip, across not just the Hudson Valley, but across really upstate New York and our more rural areas and our small rural cities, this is a beacon, a shining beacon of what our communities deserve. So thank you very much. It's an honor to be here, and I look forward to being a part of the success.
So it's now my pleasure to introduce our mayor, Steve Noble. Steve was here also at the beginning when we were breaking ground. It must be really amazing to come like 2 years ago and then to come back again, because we were putting shovels in the dirt over there, and here we are. So Steve was born and raised in Kingston. He became mayor in 2016. Still at it. And the mayor's had leadership positions with the Ulster County Resource Recovery Agency, the Environmental Management Council, Hudson River Estuary Management Committee, and is co-founder of the Kingston Land Trust. And we're so excited to have had your support all this time. So, Steve?
So I will also try not to repeat all of the really amazing words that were said today, but I think when I look out into this room, I see a community of caring. And I think as mayor of Kingston, we are so lucky to be able to have so many partners, whether it's in the nonprofit world, our healthcare world, our community services that have stepped up to help the Kingston community and literally develop programs that didn't exist before to be able to serve our residents when they saw a need. And so each and every person in this room has played a role into how we got here today. Because we wouldn't be here today with the Institute if all of you didn't care. And I think that that's really what makes Kingston special and what sets us apart from some of the other communities in the Hudson Valley, because instead of siloing ourselves to deal with these issues, we said, how can we come together with our partners at O Positive? How can we come together with our partners at Novo? How can we come together with our different healthcare partners, whether it's our Health Alliance hospital system or the Institute for Family Health and all of our local physicians and doctors. And we all came together to say that we want to put healthcare first for all residents, and that we all deserve the ability to walk into a healthcare institution and be served without a million questions, and not have to decide based on what those questions were, the quality of service that you were going to get. And so we've said no to that. And I hope that this message reverberates throughout the Hudson Valley and throughout the state to actually say that we can do healthcare better. And we can do healthcare better, and we're proving it right here in Kingston. And all you have to do is now come to this really amazing facility on Pine Street in the heart of Kingston to be able to actually see it happening. And while you're here, you can also get checked out because everybody needs a little bit of help once in a while. And I told this story 2 years ago, but construction takes a while, so you're probably not going to remember that I told it. So I'm going to tell it again. So I, and I think Marta was actually a part of my son's care. He was born in 2010 as a preemie. He was really small and needed a lot of support during his early life. And we were actually had a practice that we went to, and but after coming out of the hospital, he needed some specialized assistance. And our primary care physician at the time said, "No, we can't help you." We called our insurance company. They're like, "We can't help you either. The coverage that he needs, the care that he needs to be, we can't do it. We're not going to help." And so we were like, "What do we do?" And so someone suggested they should reach out to the Institute for Family Health because they help people that need help. And so my wife and I did. And thankfully, he turned out great because of the care. And so he went through the Institute up until he was 6 years old. And he had a really great experience as part of your family. So thank you.
So that is what it's all about. So I am going to do something that's really risky. People say that I'm a risk taker. So I'm going to do something that's really risky, and I'm going to try to acknowledge some people. And the risk is always that you leave people out who are super important, and like these people, or that you can't read the handwriting of somebody that hands you a piece of paper that says, definitely, oh yeah, there it is. So I'm gonna really try to do this, and with apologies at the beginning and at the end for anybody that I leave out. But the first thing I need to do is to remind you that nonprofits like the Institute are really here because of our board of directors. And so I want to introduce you to the people on our board who are here. I have been really fortunate for decades now to have the support of Ollie Brown Carrington. Ollie, who is our board chair. And no CEO can do what they do without having a board chair that both tells them what to do, but also listens. And it's a real partnership that we've had for many, many years. Tina, is Tina here? Okay. Steve Kelly, who's our finance chair, and as president of Ellenville Regional Hospital. Steve and I have been working. Steve is an advisor as well as a board member, and has really helped with an area that he's expert in that I'm not, which is finance, but we have worked together, and I sit on his board and he sits on ours, and that's been a partnership that we've had since 2007, which has really been great. Sam Santiago, I did see Sam. Where's Sam? Sam, board member. Carol Furman, and Robert Perry, who was a board member and is now on our finance committee. And did anybody else show up from the board? That's pretty much the major part. So thank you for our board members and their leadership. We also have leadership in the region. As you heard, we have a number of health centers in the area. And I know a number of our regional leaders are here, and I wanted to introduce them. I have a personal sort of hero that, you know, everybody likes to look up to somebody. And the person that I've really looked up to ever since we came to Mid-Hudson is Dr. Walter Woodley. Where's Walter? So why do I look up to Walter? Well, not just because he's a foot taller than I am, but also one of the first times we were walking around Kingston, we just walked down one of the streets. I can't even remember what street it was, and every time we would pass somebody, he would go, "Oh, I delivered her baby," and then he'd say, "I took care of her parents," you know, and when they were, and I was like, Walter, how could you possibly have taken care of everybody in Kingston? And there's almost nobody in Kingston who doesn't know Dr. Woodley, and he's still just an amazing human being who, through all of our work here, is the one person you can always count on. If there's a hole somewhere, a schedule that needs to be filled, somebody that needs to be seen, he's there and he does it. He really is the epitome of what physicians still are, and there's still people like him. Wes Ho, are you here? Okay. Is Megan here? Hey, Megan McMullen. So I talked about our residency program. Megan has been running our residency program for a long time and is responsible for the graduation of a lot of the doctors who now work in our system and elsewhere. And is Mark here? Not yet. Okay. And then we have, because this is a whole region, we have regional leadership too. Is Angie? Where's Angie? Angie's here. Is Angie Salgado Vasquez, who's our regional nursing director, Levon Freeman, who's our regional behavioral health director, and Heather Mason, who's our regional practice administrator. These are people who have senior leadership positions in our organization. And then the Institute's leadership, and this is where I'm going to get in real trouble because I don't know who's all here. But Tracy, I know you're here. Where's Tracy? Tracy is our chief operating officer, and Tracy is responsible for overseeing all of the things, including our facility development. And of course, nothing happens without money, and I want to recognize Carol Boughton. Carol negotiates all of our contracts with our managed care companies. She is responsible for the billing department that keeps us alive and keeps my paycheck coming and everybody else's paycheck coming, and is just announced her retirement. We are in mourning for her leaving because she's been such an absolutely critical part of this organization for many years. We have our president for academic affairs, Red Schiller, who is responsible for overseeing all of our training programs and keeps reminding me, but we've been partners in this effort for 35 years. So he's an amazing physician and a wonderful leader of all of our training programs. Our president for healthcare services, Dr. Eric Gale. There's Eric. And we have two vice presidents for program development, one who's been with me for many, many, many years, Maxine Golub, and our new incoming vice president for program development, Kate Fahey. And Susanna Callahan is here. I saw Susanna. way in the back, our VP for Community Engagement. Susanna and Kate are owed an extra special thanks. They're the ones who've put together this event today and put a huge amount of energy into that. We really appreciate that. Community groups. Family of Woodstock, here? Yeah, thank you. Center for Creative Education. The Ulster Immigrant Defense Network. The Good Work Institute, great name. Live Well Kingston, another great name. People USA, and Broadway Bubble. I also want to acknowledge Marie Manjan from the Community Health Center Association of New York State. Marie and I worked together on the policy committee, and so I talked about some of the things that we're working on in policy. Marie runs the policy issues for all of the community health centers, 65 of them in New York State. So very important role, and I've had the pleasure of chairing that committee now in its for my second year as chair. So a lot of work still to be done there, but great leadership from Marie. I just want to also acknowledge the board of the Pine Street Professional Complex. We had a lot of things that we needed to do, and the board was very helpful and supportive in that. The Kingston City Planning, Sue Cahill and the Kingston Building Safety, and the Sheriff's Office of Sheriff Juan Figueroa, who's represented by Colonel James Mullen. Colonel, I saw, maybe got called out. Our partners at Westchester Medical Center, Pavan Naidu and Francis Song, and they are here. And let's see. And then there's somebody I gave a big, really big hug to when he walked in the door, and that's Joe Concra. So why did I give Joe a big hug? Because Joe made the connection for us with Novo and really brought these two organizations together and basically said, hey, these are good guys. And then said to them, hey, these are good guys. And when you have that kind of an endorsement, you end up with a medical building. But this is really amazing. And they've just opened their free clinic just blocks from here. We plan to have a very close working relationship with them. And also want to thank the O Positive team that's collaborated with the Institute on our art projects, the mural at Kingston Peds, and we have been collaborating with the O Positive Festival for many years. And community agencies. Just to say, one of the first things that we did here was we basically had a listening session. There was a church, I don't remember the name of the church, but we brought together, 20, 30, wasn't it, Vin? It was about a whole bunch of community people and said, we're building a health center, what do you think it should have? And we still have the list. There's about 80 things on the list. I think we'll fulfill a bunch of them, but one of the things was to have a community space in a health facility that could focus on the health needs of a community, be able to do community health education, as you heard from Dr. Sanchez, to be able to invite community groups in, to be able to do what they do, to teach people, to work with people, and we're looking super forward to that. So also want to acknowledge, I think, is Dr. Doyle here? Hey, thank you. In fact, really long-standing, longer than I've been standing, partnership with Kingston Hospital, now the Health Alliance Hospital. That's basically been our training partner for our residency programs for since they were started, and thrilled to be now in new facilities there, and and he's responsible for a lot of what's happened and a lot of the innovations and development that has gone on there. So that's been a long-standing partnership that we look forward to continuing. Also, you saw me acknowledge Vin. Thank you for the work that we do together with the health department. People have always separated public health from healthcare delivery. And there are some people like Vin and the health department here that actually realize that this is all one thing and that we're all working together in these kinds of programs, and how important it is for people to work together on these kinds of projects. And so we look forward to continuing collaboration with you and the health department in every way we can, whether it's behavioral health or primary care. And then I just finally want to thank Radio Kingston, which is really important. They were here. We appreciate them setting up the PA system so I didn't have to drag it from the basement where all my band equipment is stored, but also for acknowledging how important this is in the community, from the groundbreaking to here. And finally, but probably most importantly, so one of the reasons we're in this gorgeous facility is because of someone who I've had the pleasure of partnering with, God, for I think since the first facility that we did in long time ago. I have to stop saying years because people are like, wow, he's that old. So, and that's John Bryce. John Bryce has been our architect from the first project that we've done all the way through to this beautiful building. And I could tell a million stories about, the work that we've done. And there's something special about facilities. When you walk into a facility, you have a certain feel for it, right? You either can walk down the stairs into the basement and kind of feel one way, or you can walk upstairs and have sunlight and beautiful things happen. And if you were to see our facilities, you would think that you were in the most expensive places on Madison Avenue, or the most expensive and high-heeled communities. We have always believed that the respect that you show people by how you build a place is as important as the care that you give, because when somebody walks in, they either feel like $1 million or they feel like they're somebody who doesn't deserve, to have the best. And so they get something that's less than the best. And so every facility that we've been able to build, the downside of that is we usually estimated, that it would cost $5 million to build a place, and John would come back with a plan that would be priced at $8.5 million. We'd say, but John, we only have $5 million. And we would then go through this process I've learned, which is called value engineering. That's basically a euphemism for cutting the budget. And but if you did it with the kind of skill that he had, we were able to do this. I mean, just the way this outside was, the price tag on this was just extraordinary. And we said, well, John, I don't know if we can really do that. And they said, well, maybe we can do something almost identical. And so this is the almost identical, which to me looks like it's the most gorgeous thing I've ever seen. But, it didn't require somebody importing the wood from Africa and the metal from some metal place that was like known all over the world. And so, but you end up with a vision, and our health centers, every one of our health centers just has his name written all over it in terms of the vision that he had. And he, nobody does anything alone. And so John didn't do anything alone either with this stuff. And so he was part of this great group called Geddes Partnership. And Barbara Geddes, who's their chief, is here. And Geddes has basically been working with us for a long time. And his work, John unfortunately passed away in the middle of this project. And it was unexpected, it was sudden, it was tragic. we all still feel the loss. I still feel like, where is he? You know, it's been a very, very hard project to be celebrating something and then realizing that he's not here any longer to celebrate with us. And that's been really, really, really hard for all of us. But we decided that we wanted to dedicate this building as his sort of the last of his efforts in really bringing quality healthcare to the community. And so we prepared, this is a mock-up of a brass plaque that will be in the entrance to the building. It says, Pine Street Family Health Center is dedicated to the memory of our colleague, friend, and the architect of this facility, John Bryce, whose commitment to community health is reflected in the bright and welcoming spaces he created for patients and healthcare workers. John's legacy of healthcare design is reflected throughout the Institute for Family Health's network of practices. We are forever grateful for John's vision, talent, and commitment to our mission. And that will be in the entrance. And we have a smaller version of this for Yvonne and the family. So we're honored to have John's oldest son, Nicholas, here with his wife, Colleen, and his kids, whose names I can't all remember because I can't even remember my kids' names, so don't feel bad, kids. But these John and Yvonne's grandchildren, Jack and Gemma and Charlie. Charlie, thank you. Sorry, I did write it down, but I can't find the page. So, yeah. And so let's see if I forgot anybody. Did I forget anybody, Kate? Okay. So I have to keep going? I thought I was done. Oh, a ribbon cutting. No. Sorry. Oh, yeah. So, right. The people who built the building. What the hell? I know.
Okay.
Yeah. MGI Contracting. Are they here? You have to come in so people can see who you are. Sorry, but SRW Engineers. And Hudson Land Design. Where's Hudson? Okay. When you do this stuff, it's who really implements the project that matters. I kept coming by here. They would throw one of those hard hat things on and walk us through the building. But it's an amazing process to see what happened here. Did I forget anybody else? No. So now we can do a ribbon cutting. But I want to, before we start, I'm going to go off. Yeah, where's Ken? He was hobbling around here someplace. Ken? Hamilton. Oh, he left. No, I'm just kidding. But I want all the staff that Dr. Sanchez introduced to come up for a picture, because these are the folks that are going to make it happen. So you heard this before, but come on, everybody. There's always a place for Dr. Woodley in the. Eric, Red, come on. Hang on, these are. All right.
Come on.
All right.
Thank you.
Great. And then can we have the members of our board of directors come up? Ali, can you bring your board up? Carol, Sam, Steve. Bob? Yeah. All right. And can you guys come up for a picture? Come on. Here. Everybody look over that way. Look over there. Wow. Great, thanks. Okay, Kate, the rest is up to you. So, this is, yeah, okay, now we're gonna cut the ribbon. Peter. Peter. Vin, why don't you come up too? Really? Come on here.
Okay.
You should be in the middle.
All right. All right.
Okay, now, the idea is to catch the picture before the ribbon hits the floor. Ready? 1, 2, 3. Ooh. Oops. Oh, we missed. All right. You okay? Yes, almost severed the funder's finger in the middle of this. That's okay. Bad. So, Kate, are we done?
We want to take some more photos.
Okay. So will you organize that? Sure. Great. Thank you. And then for those who really want to a tour, the building's open for tours, and there are plenty of staff people who can show you around. You can see what a state-of-the-art design looks like for a primary care center. And I just want to thank all of you for being here. I know I forgot to acknowledge somebody that'll come up to me and say, thanks for not mentioning my name. But anyway, thank you all for being here. It's really an honor to have you be here to celebrate this great event with us, and we really appreciate it. So have a great day. Take a look around. Eat some food, please.